Folks, I told you guys I have them but the heavy hitters. I got a doctor in the house. And this doctor, at his magical hands, it makes things look even better. And I'm so excited. I met him at a kids' party over burgers, eating burgers. And I'm so excited to have him on. And, I always want to highlight people who are doing great things and their stories. And people who you might heard about, now you know, put the face with the name. And after these messages, we talk to the doctor. Right back at these messages.
We made a pledge to do what's best for the health of our communities, and we continue to deliver on it every day for every one of our members. With access to a network of over 1 million providers, rewards for living healthy, and more care options than ever, we are CareFirst Blue Cross Blue Shield, and we are changing healthcare for all that we serve. At CareFirst, it's not just our name, it's our promise.
Welcome to NoPixAfterDark podcast. I'm your host, Aaron Dante. I told you folks, we got the doctor in the house. And I got my guy, so Dr. Babar. How are you?
Doing well, Aaron. Thank you for having me today.
Oh, we've been trying to do this forever. You and I have been trying, over a year. We've been trying to make this happen. And you're like, I'm ready to do it. Let's make it happen. So thank you for your time.
Thank you for having me.
I appreciate it. So tell people what you got going on. What kind of doctor you are?
So I'm a facial plastic surgeon. My practice is located in Towson, and I primarily do facial aesthetic surgery, which means basically cosmetic changes to the face, just above the neck. Okay. And I also do injectables and all that kind of stuff.
So Botox and all that good stuff.
Yeah, fillers, laser resurfacing, and all that stuff. And I do it all myself too, in the sense that I personally inject the patients and I do the lasers myself because I'm a really anal person.
I get it. Like you don't have an assistant doing it. It's you.
Yeah, and the patients prefer that.
You don't find that anymore. Like most doctors, like, oh, I'll be there. I'll just oversee and watch it, and my other person will take care. You're like, okay, all right.
But I enjoyed the social aspect. Okay. Every time you have an interaction with someone, we talk about what's going on in the world, what's going on in their life. We pick up right where we left off the last time I saw them.
I love that. I love hearing about that. So let's get a little bit of background about you.
Sure.
Are you from Maryland? Are you from this area?
Actually, I grew up in Maryland, but I grew up in a bunch of different places.
Okay.
So I was born in Pakistan, in Lahore. And then my dad grew up reading Sears magazines.
Okay.
And he was like, wow, look at all these different things. And he wanted to give the kids more opportunity than what he saw there. So he eventually got a student visa to go to San Diego. So that's where I grew up for 4 years. And that was kind of interesting because I showed up and didn't know a lick of English in the playground. And they thought I was Mexican. So they paired me with a Spanish-speaking kid.
No.
So I came back home the first day very confused.
You're like, all right, I've learned English, but now I'll learn Spanish.
I knew hello and thank you, and I came back with hola and gracias. So there you go. But it was great. I loved the diversity and the experiences I had in San Diego, and we were there for 4 years, and then we actually went back to Pakistan for a year, and then we came here to Columbia or Ellicott City, Maryland, and that's where I grew up.
Okay, and then from there, like, did your parents, were they in any type of profession? Living here? Were they medical doctors?
My dad was an engineer.
Okay.
He worked for GE Healthcare.
Oh, GE. That was big back in the day.
Yeah, absolutely. So fast forwarding, whenever my kids are born and he goes to the hospital, he goes, oh, I helped with that incubator. I helped with that. I'm like, there's the kid. He goes, no, there's the incubator.
I love that. But he's happy. He's proud of being a part of that.
Exactly. And then my mom was a trained nutritionist, but she became a homemaker to help raise us.
Got you. Where'd you end up going your undergrad and grad?
I did my undergrad at Princeton University, and then I did medical school at Harvard Medical School.
Okay. And when did you know you wanted to be like a doctor? Like, was that something like growing up? Did you I think me and you are probably around the same age, I'm thinking. I remember Doogie Howser, MD. That was like the first and stuff, things of that nature. But was there somebody that you saw like growing up, like, oh, that's pretty cool. I kind of want to do that. Like,
so in our culture, that's a particular profession that's strongly encouraged.
Okay.
But I never had a passion for it growing up as a child or even in college. I had watched that movie Perfect Murder, and the Michael Douglas character, I want to be a stockbroker. It looked really cool. So I was actually an economics major in college. But then I also did EMT, or emergency medical technician, and ambulance stuff during college. And eventually, during junior year, you kind of decide, am I going to do an internship in New York with, J.P. Morgan and all that stuff? And I just realized I couldn't sit behind a desk. I liked, again, the personal interaction, the hands-on stuff. And so I took a gap year, actually, between college and then applying to med school. So I was in San Francisco for 1 year.
Okay.
And that's when slowly I started to develop my interest in medicine.
That's interesting. That is so cool, because it's always like, I had somebody that was uncle or aunt or somebody who was like, you should become this or like that. And just, you being EMT at school is kind of like, it's kind of cool. Like
I had an aunt that was a doctor and an uncle that was a doctor, but that didn't inspire me to be a doctor per se.
Got you. And so, like, when you decided you're like, I want to go to medical school, did you know what area did you want expertise in, or did you know where you wanted to be in? Or
I just wanted to make sure I knew all my anatomy.
Okay.
It's a lot of information coming at you at once.
Right.
I had no idea what kind of doctor I wanted to be. I knew that I liked a stressful, fast-paced kind of situations.
Okay.
And so maybe a primary care outpatient setting wasn't going to be the place for me per se, but I kept a very open mind.
Okay.
And it took till the very end to decide what I was going to be.
Wow. That's So you really were. Was it a late that you decided? Was it like too late when you're major, or was it most people decided during the same time when you guys all decided at the same time, or is it mandatory?
So the way med school works is the first year is very much
General.
You're in classroom setting and you're learning physiology, anatomy. Second year, it's more pathophysiology, like learning what bad stuff happens and how to handle it. Third year is clinical, and that's when you do your clinical rotations. And fourth year is when you subspecialize and figure out which rotations are you particularly interested in. And it's during that time that I decided, and that's when you apply for residency.
Okay. And at that point, you were like, all right, I want to be a plastic surgeon. Is that where it came from? Or like, how did you go into that foray?
So my residency was actually in otolaryngology, head and neck surgery. Say that, Aaron.
I'm not even. I was like, you know what? You won. I'm not. I don't even know.
Just try it once for me.
Okay, say it one more time.
Otolaryngology.
Otolaryngology.
There you go.
I'm not going to ever say it again, but otolaryngology.
Yeah.
What is that, doctor?
So that's ENT, or ear, nose, throat, or head and neck surgery. So that's what I applied into for my residency. And that's ultimately leads into several subspecialties, including sinus surgery, ear surgery, or facial plastic surgery, which is my particular specialty.
Wow. So, what made you want to do that? What made you want to all right, I want to help reconstruct or help something help somebody's appearance, enhance it? What made you want to do that?
Oh, so as far as facial plastic surgery?
Yeah. Was that something part of that, or not really when you were in?
During med school, no.
No, okay.
No. At that point, I liked the fact that in this particular field, you could fully manage a patient medically, surgically, and evaluate them from. You didn't have to refer anybody for the medical part or this for the surgical part. And I love the intricacy of the anatomy. The head and neck region is just absolutely beautiful and complex. And I enjoyed that aspect. The surgeries were varied. You could be holding a scope, looking at a screen. You could be under a microscope, or you could have someone's neck completely open, looking at the carotid and jugular. So that was incredible to me.
Yeah, my only ear, nose, and throat story would be I have sinuses and sinus problems, and then I was 25 or 26 years old, and I had to take my tonsils out. And let me tell you, I thought I was strong. You know how sometimes it's like, listen to your doctor, and you're like, your doctor doesn't really know everything. And I remember with surgery with Dr. G at GBMC.
Who was your doctor?
I couldn't. If I told you right now, I'd be lying to you. I couldn't tell you. That's how long ago it was. I'll let you know on the back end. And he was like, "You're gonna feel like hell for like 10 days," or it was like a long time. And I was like, "There's no way." And they're like, "Because you're older, it's worse." And I remember I stayed at my parents' house, and my parents were like, "Come to South Carolina with us. You can ride in the car." And I was like, "I can't do anything." They're like, "We don't want to leave you home by yourself." I'm like, I'm good for the first couple of days. I'm fine. When they left, I slept in the bed probably out of a 24-hour day, 18 hours. It was the most painful thing I've ever had, where I lost weight, which was a good thing for that, but I just couldn't eat anything. My appetite was gone.
Sure.
You probably know since you've dealt with that. That's my only story for that. That's all I got.
Well, tonsillectomy is a very painful surgery, but most people are grateful for when they have it.
Right. And now I have to go. Actually, it's funny. I have to get a new one. It's funny you say that because I have to get a new ear, nose, endo because now my hearing, my nasals is all messed up. So I got to figure that out.
We'll do that on the last end.
Yeah, we'll do that then. So you went through that, and then when you graduated, what was your first assignment?
So after med school, we do residency, and you apply. So I traveled all across the country, applying at different places. And the way it works for residency is you rank the different programs, and then they rank you. And there's a quote-unquote match that takes place. And I got picked to come to Johns Hopkins.
There you go.
Yeah.
And is that where you wanted to go?
It was my number 2 choice, actually.
I was hoping you were saying it. Yeah. What was your number one choice?
I grew up in near the Baltimore area.
Right.
And I was like, I swore I would never come back.
Right. It's most people say they don't want to come back. What was your number one choice?
It was to stay at Harvard.
Okay.
Yeah.
All right. So, and so you're like, all right. So you want to stay in Boston? That's
a creature of comfort.
Right. Was your family happy that you were coming back home?
I mean, that was the issue. You can't say no. So I didn't want to rank Hopkins too in that regard, but it's a great program. It's one of the world's best, and my family's here, so you couldn't say no. So there I was coming to Baltimore.
I love it. Only on NoPixAfterDark you're here. That's my phone. Sorry. Only on NoPixAfterDark you're here. Hopkins was number 2. I love it. So from there, you did your residency, and how'd that go? From here, how'd that go?
So I lived mainly in Canton the majority of the time.
Had a good time.
And it's a great time. Learned a tremendous amount by world-class surgeons, great mentorship, great life experiences, maturity, and everything like that. And then I decided I had a few mentors in the facial plastic surgery field, specifically Dr. Patrick Byrne and Dr. Kofi Boaheen. And I really got attracted to the field of facial plastic surgery.
And I've seen wonders. I have good friends who are in bad accidents, and I've seen the wonders of what they pretty much did. I call you guys artists. You're the artists of the surgery, of the doctors in the world. And my one friend had a huge scar from a car accident, and they just made him look almost 95% look how he looked before. And so I commend you on all that stuff, like things of that nature.
Oh, it's such a varied field. I had no idea. Meaning you can go from reconstruction, where people have the majority of their jaw or face removed, and you're reconstructing it from their leg or from their arms.
Explain that real quick, because I know we're going to rewind that. How would you use the skin from the other part, or?
So the head and neck is a very complex area.
Okay.
So let's say you have a cancer of the jaw.
Right.
So that's bone. And it spreads to the soft tissue, which is the mucosa or your cheek area, and that has to be removed. So there's a big hole in your face. So how are you going to fix that? You just can't put skin there.
No.
You have to reconstruct that. So what you actually do is take your fibula, portion of your fibula, which is a bone down in your leg. You take associated muscle with it. You may take associated skin with it, and you move it all the way up here. And you use plates to reconstruct the bone, the soft tissue.
Wow.
And then you have to, but the intricate part is actually, this is living tissue. So you actually take the vessels from there and connect them to the vessels in the head and neck. So it becomes living tissue on your face. And that's called free flap surgery.
Wow. See, that's why they pay the big bucks. Because Doc, I didn't ever think anything like that. And wow, that's interesting. It's very interesting.
So it's totally incredible. And that's just a portion of the reconstruction. Facial skin cancers are very prevalent nowadays as people are learning more about, screening and such, and often portions are removed, which can lead to a significant hole in your face, and you have to reconstruct those in intricate ways. After it's Mohs surgery is typically what's done to remove the cancer, and you do some reconstruction to recreate the deficit. So that's also very interesting. There's trauma You can have anything from blunt trauma from a car accident to shooting victims and all that stuff. You've seen facial transplant patients and such. So that's also a portion of it. Then you get into some of the not necessarily artistic, but more the aesthetic stuff as far as nose reshaping surgery, aging face surgery, gender affirmation surgery. So the field is very varied.
Wow.
And even within such a subspecialty of facial plastic surgery, people are subspecialized within that.
Wow.
Whether they subspecialize in gender affirmation, or they're a rhinoplasty expert, or an aging face expert. So it's pretty cool.
I love learning about this. What we're going to do is take a quick break.
Mm-hmm.
On the other side of the break, we're going to talk about when you wanted to start your own business.
Sure.
Like in this, were you nervous? What was it? Were you nervous about putting your name out there, being that person, and now it's like, this is my business. This is how I'm running it. We'll be right back at these messages, folks.
Are you or someone you love in need of mental health support? For All Seasons is now offering same-day therapy appointments with no wait list. Through the For All Seasons Open Access program, you can walk in for mental health services and begin therapy in the same visit. For All Seasons accepts all insurances and provides financial assistance if you need it. For therapy, psychiatry, or victim support, we have appointments available today. Call For All Seasons 410-822-1018.
You give to United Way, your gift could be the first spark of something bigger. It can help someone find, interview for, and get hired for a job, and provide follow-up services for success. It can break down educational barriers and give that extra help to a struggling student with in-school support programs. Give today. Spark something bigger.
And folks, we are back. This is a spirited discussion. I'm talking about things coming out your foot and you coming into your face, and I mean, I'm in love with this, Dr. Babar. Thank you so much again for hanging out and just educating me and the audience about what you do, how you've gotten to where you've gotten. Here's the question now: you have your own business. How did we get there? I mean, how long did you work with somebody or with another practice before you got your own business?
So that's a great question. And that's where the story goes from Baltimore to where I moved to Carmel, Indiana.
Okay.
So I did a fellowship. So I did a fellowship in facial plastic surgery with a gentleman named Dr. Steve Perkins. And there I learned how to start my own practice. And at the end of my fellowship, this gentleman helped me set up a pro forma and understand how to move forward with that. So I came back to Maryland. My wife and I did long distance during that year, which was tough, but she was incredibly supportive, and she's a realtor in this area, so which was nice. So when I came back, she financially supported us. And I had the opportunity to find a loan, find a space. If by she helped also in finding a space, finding a loan, determining the architects for the build out, all these details that took place. And I'll tell you, that was the toughest time. It was so incredibly difficult just sitting there. You're fully trained. You're ready to go. You have that excitement in you, but it's like, stop. You can't do anything yet.
Right.
You have to wait for this to go.
Right.
So it took I would say about 14 months between finding the space, the build out and such. I do have to give a shout out to M&T Bank. They were amazing. I think they work great with small businesses, and they gave me my loan and took a shot on me. And for a person, so as a physician applying for a loan to start a business, you have no assets. You only have debt.
Facts. All you have is debt from school.
Yeah.
Correct.
And so that was interesting. But so once the business was starting, I told my wife, "Babe, we cannot have any vacation scheduled. It's going to be so busy. I can't wait." I was so excited. The first day I showed up an hour early before the office opened, was ready. I'd checked the phones already to make sure they all worked and everything. And I left half an hour late that day. We only had one call that day. It was the wrong number.
Oh, wow.
So it takes a while.
Right.
For what I do, it takes an incredibly long time.
Correct.
I don't work within a healthcare system. I don't work for a university system. All your clients come because they've heard of you.
Referrals mostly.
So you had to get your hands wet and get yourself integrated into the community. So I started working helping emergency rooms with laceration repairs to the face. So I worked at GBMC and at St. Joe's, and then other people get to know you, and that's how you develop it. So my practice is mainly a word of mouth practice.
From doing that, so you were like, at this point you're hustling to get clients, and you're working through the hospitals and
just
whatnot.
to get more exposure.
And what was that moment when those doors opened? How did that feel? Besides, forget anybody calling. How did that feel? That journey of getting to the doors opening with your name and your business. How did that feel?
You got a few sleepless nights.
Okay.
And you go, is this going to go or not go? You know, you're always comparing yourself. And you're going, and you know, everyone expresses their best version of themselves, and you kind of go, is that reality or not reality? And I learned that with starting my businesses. Don't listen to other people. The truth is halfway there.
Right.
I think just strong family life, having that support at home helped. Every time I would come home and question myself, I got you're going to do great. You're good at what you do. It's going to happen. And with word of mouth business, it's not linear. It's logarithmic. You touch 3 people. Those 3 people each tell 3 people. It just grows and grows and grows. And that's how it happens. And in my field, it's people can go to anyone for Botox or filler. They want to go to the person that they're going to enjoy seeing. And the person that they trust is going to have their best interest in mind.
I love that because it kind of reminds me of when I started a podcast. And like you said, you know, the first 6 months, I had friends from college that I already knew that could be on the show. And a lot of people, what happens after the first 6 months or so, that's when you really find out with podcasts if they really are good, because you've run through your friends. How do you grow from there? How do you adapt and a word of mouth? Oh, this guy's doing this. Oh, this guy's doing this. Oh, and now I don't even have to look for a guest. It's kind of like, oh, okay, cool. You know, like, you want to come on? Let's talk about it. You know, and I like your story that it takes time, and if people want to trust you, it's like I'm telling your story. You have to trust that the story's gonna come out the way you want to hear it. Just like if I come to you, I hope that you do what you do and you make sure I get the results that I'm looking for. But you have to be honest as a doctor. This is not going to be what you may think it's going to be. We're going to get close enough. Is that some of the kind of hard conversations you have to have with some of your clients?
Well, so managing expectations
Yes.
is incredibly important. And I think that's, at least in my field in facial plastic or plastic surgery, where the doctor-patient relationship fails sometimes.
Right.
Is either the physician's too eager to move forward with surgery and doesn't really measure the patient's expectations. So communication's key. And I really, really try to talk about realistic expectations. And my results tend to be very natural. And I don't go to the extreme stuff. And I try to make something that is realistic. So if someone comes in with a storyboard of 10 different celebrity noses they want, of a different ethnicity than they are, that's just not going to work.
Right.
So, you know, just that. But you can't be like dismissive of someone either. You have to understand where they're coming from.
Right.
So I'm a big educator. So the way I would start a consultation, Aaron, if you would come to me, is I'm going to pretend like you don't know anything, even though you know everything. So let's start from scratch. And we'll just use very basic terms. And we have a long talk. So I do the whole consultation. It's not as if someone comes in and writes something in a checklist. What are you interested in? And I come in for 2 seconds, touch you, and then someone else gives you a quote. I really manage it the whole way.
I love that. That's what it's all about. That's all about being personable and knowing your client and knowing the customer, making sure they feel comfortable. Because that's a major surgery that you're doing. And I feel like you have to have trust and feel comfortable with the person, knowing that, you know what, they're going to make sure to look out for my best interests at the end of the day.
Oh, yeah. Meaning, and that's why I've had multiple generations I take care of already in this practice that's, 8 years old. It's not, meaning moms, daughters, their moms. It's just, I enjoy that aspect, and it's such an honor. But it might be a personality strength, but it's also a personality flaw being that anal as well, because anytime a patient's not happy, I take it very much like, what can we do to make this better?
Right.
I can't just sleep at night knowing someone is not very ecstatic about where they want.
You're an artist. You are artist. Has technology helped since you've been in the game when you started from medical school, like as far as technology with how the image of how the face will look or how reconstruction, like can it really pinpoint close enough to where people are like, oh, this is what I will possibly look like, or this is what it will look like when it's done?
So that's a great question. So again, I don't do any very much reconstruction. I do mainly aesthetic surgery.
Right.
But as far as that technology goes, it's been a plus, but mainly it's been confusing as well.
Okay.
Filters. When people
Love filters,
look
yeah.
at Instagram
Oh,
and
no.
they look at appearances and they want those results, but they don't know what that person looks like in real life. Right. And they want that face as their face. So that's very, very confusing. And they will come in wanting that result. And then the problem with imaging is I use it as a communication tool.
Okay.
But I never say, here's a picture of what you're going to look like. Do you understand? Because then
Yes.
people are married to that photoshopped picture. And you shouldn't pick your surgeon as to how good they are at Photoshop. So what I often say to a patient is, go to my website, look at my before and afters. That's the truth.
Right. That's proof in the pudding.
There you go.
I find that essentially you said fillers and things of that nature, and it's always interesting because I guess from my perspective, do you find that a lot of people want to look like certain people out there, or do you find that a lot of your customers say, hey, I want to have enhanced a different looking nose, or I want my lips to be a little bit perkier or a little bit fuller, things of that nature? Do you think because they see it on social media, it's a pressure now to keep up looking that way?
Oh, absolutely. Social media and then Zoom calls too.
Oh yes.
Because you're looking at yourself the whole time.
Right.
And that's during COVID, there was a huge burst in facial plastic surgery or plastic surgery.
Did not know that.
Yeah, because people were looking at themselves on Zoom and they go, oh, between my brow, I'm starting to see this line. I need to take care of that. Or, wow, my neck is really, I got a double chin. I never realized that.
Wow.
But again, what I try to do when someone comes in with those kind of requests is I say, just why don't, instead of talking about what procedure you want or what technique you want, tell me just in general terms what bothers you. And then I try to present them with varied options. And then we go there. Do you understand?
I like that. That's personable, but that's like you care. You're caring about, hey, I'm going to make sure the best result you want out of this whole
And
project.
a natural result. And if
I like
someone
that.
asks me to do something outside of my comfort level, I'll just say, I don't feel comfortable. I respect that what you want to do, but I just can't do it to the level.
How does that feel saying that to somebody? Have you said that to any client?
Oh, of course.
Is that pretty hard to turn down? That to, some people are like, this is a $10,000. I can make this quickly, or but it sounds like you are like, I have a conscience. I'm not going to go down this road.
I take out of 1,000 compliments, the one patient not being happy will bother me. It's like the princess on the pea.
I love it.
No, I'm being serious. Like you can ask my patient coordinators that. I take it very personally, and not as a personal pride thing, but just what can I do? So if I can't realistically give you what's going to make you happy, I just say that. And I think, but you have to be respectful. You're not dismissive, but you just can't also just say, oh, okay, and have 6 people that aren't happy because you just said, okay.
I like that. Like, what have you learned about yourself during this whole experience? Like, you might be opening your own business. How many years have you been in business for that now?
So now we're almost getting into 8 to 9 years.
So, I mean, again, you succeeded past the mark where most businesses do not make it. How do you how do you see yourself now? Like, as far as a doctor grown?
So there's a couple of things. From a personal perspective, I'll talk to you in a second, but from a business perspective, usually now is when people decide, how do I want to grow?
Right.
Do I take on a junior partner? Do I bring in a bigger space and add more treatment options and all that stuff? And that, I am so anal, I can't do.
You want your hands on it.
Yes.
You don't want to open another spot and have to be at 2 different spots. You don't want to break. I get it.
My patients have my cell phone, so they know how to get a hold of me. They're not getting an answering service and all that stuff. So that's just not an option for me. I don't want anyone else having to do that. From a personal perspective, it's a gratifying experience, but you never take anything for granted. You always got to stay. I don't like the term hungry, but always eager to be better. And I think self-evaluation is important. And with my group and I will often sit down and say, what can we do better? If you lose track of that, then you will become a dinosaur and you will go down.
I love that. And that's what it's all about. You have to get better every day. I always tell myself, how can I get better than yesterday? How can I be better than last year? Am I going to stay stagnant? Am I going to be different? Am I going to be something that's, I want to be in this guy's show because this guy's doing something different. And I like that. That's great. That's great advice for anybody who's listening out there.
Yeah, meaning I'm not going to do what I just learned yesterday the next day. No, but it's just you always want to learn. And I'm really blessed that I know some of the best facial plastic surgeons in this country, and I can count them as good, or great friends.
Gotcha.
And we often communicate and discuss with each other. So blessed in that capacity.
I like that. I like it, Doc. I love everything you've told me. Where can people find your office? Where can they go? Let's find out where it's, because the phones are probably blowing up now. They're ringing now, okay? But like, where's your office located? Where's the how to contact? Where can they go from there?
So we're in the heart of Towson off of West Road, right on 100 West Road, which is super nice. Sultan Facial, S-U-L-T-A-N, facialplastics.com is our website. It's got a lot of nice before and afters and information, and that's also our Instagram handle, and you can learn that. And then the best way to find out more about me is come visit.
I love it. Is it a free consultation?
Yes.
Okay.
I don't like the term complimentary.
I need to come in. I need a couple things fixed in my face real quick. I have a scar from way back in the day. Nah, I'm not. But no, I appreciate you taking time out your day. I know you're very busy. And I'm glad we finally made this happen. And I really appreciate your time because I tell people we can't get time back. And so I appreciate that, sir.
Well, Aaron, I was really impressed when I met you. We had a really, really nice conversation to the point that my wife had to separate us.
Yes, we had a great conversation. And I like talking to people who are doing great things. And that's inspiring. And I want the audience to listen to people like yourself. And you never know who's out there. It could be that doctor, that young guy who's like, I want to do this. I want to learn a little bit more. You never know who's out there listening or watching. And that's why I wanted you to have you on. I know you were like, I don't really know. I'm like, come on. I know you can do it. I know you. You're like, I've never been on a podcast. But it's just like me and you talking at the table again. It's just cameras around us. That's all it is. But I'm not going to let you off the hook, though.
Sure.
It's a speed round. We don't let you off the hook. It's a fun speed round. Ready?
Okay.
All right. Chicken wings, flats or drums?
Drums.
Blue cheese or ranch?
Ranch.
Crabs or crab cakes?
Crabs.
Pizza or tacos?
Tacos.
Oh, okay. All right. Snowball or ice cream?
Ice cream.
If I jumped in your car right now, what will be playing on the if you hit play? What would play? What would be playing?
105.7 The Fan.
What gets you motivated before you go into surgery? What song? Give me a song. Is there a song you play before you go in?
I play country music.
Okay, that lays you back. That gets you laid back.
Yeah,
okay.
I love listening to all kinds. Morgan Wallen. I love country music.
Do you play country music during your operation?
Correct.
Okay, all right.
It's peaceful.
It's peaceful. Okay, all right.
And it brings good memories. It talks about the beach. Talks about all kinds of good stuff.
I like it. And if it's one thing that you can look back at when you're younger self, what would you tell your younger self now?
It's going to be all good. Don't stress the small stuff.
I like it. You're off the hook. Again, tell us where you can, on what email, what website you can find again.
SultanFacialPlastics.com.
Folks, you heard it here first. This is the guy to go to. I got to go get my face checked out real quick. And, I'm trying to look a little bit younger. Trying to get a young look, but I'm joking. But thank you so much, Doc, for coming in. I really appreciate your time.
Thank you for having me, Aaron. It's a pleasure.
All right, folks. Again, you can catch me at NoPixAfterDark.com. Shows come out every Monday on YouTube, on Tuesday, on audio, on Spotify and Apple. Thank you so much. Love, peace. We're out.